Tell me your name. Steve. That's my middle name's Steven. My dad's name's Steve, so I got it now. All right, Steve, gonna do a little sound check here. And so John and I are from East Tennessee. And so if we have this little southern twang to us. And he said, John, that we're short on this because obviously these go into an amplifier. But
oh, you mean the cable link?
Yeah, cable link. So he's like, just be aware of that. You got your you got to load your snap timer in there.
I do. I thought I had it on here.
This has been the greatest piece of software we've ever picked up.
Yeah. It's beautiful.
I love Windows.
I just want to download it. There we go. Snaptimer.zip.
Beautiful.
Snaptimer.exe.
I mean, how many kilobytes is that?
Like 143 KB, which is about right. Let's roll this beautiful bean footage here.
Do a 15-minute.
15. All right. And
there's Dan. Dan. I see you, Dan.
All right. So are we just testing the stream here, or are we gonna do the actual kickoff? What do you think?
This is the kick. Well, we're
doing the real thing.
This is the real deal. Kickoff.
Sweet. Okay.
Oh yeah, he was.
Oh yeah, I'm just getting this rolling up. Just making sure we got it all ready to go.
Oh yeah.
Oh,
we will. Yeah, we're just setting this up.
Yep. Yeah, absolutely. Once we.
2 shot right there.
2 shots here.
3 shot.
3.
And then that speaker.
Okay.
Or interview. Yeah. I'm a little hot into my ears, Steve. I could just turn it down maybe 10, 15%.
I'm just a little hot in general.
You feel like you're a little hot?
I'm just kidding.
Yeah, you are. You're sexy. Yeah.
You'll be here all.
Listen, can I touch you?
I hope that made it on the stream.
It will.
Oh my gosh. Yeah, Ashley was just asking, how close are we going to sit?
If I cross my legs like this.
How close are we going to sit on the couch is the real question. Are we going to sit this close?
I'm comfortable right here.
I'm comfortable with my...
You don't have COVID. No.
Listen, we got to get loosened up here is all, okay?
This is the pre-meeting, pre-talk. How do I look now? Don't do that? So like this.
I think it's one of these. What?
No, like this.
I think I'm gonna get my gangster lean on.
I think I'm gonna end up being like this because I want to engage both the camera and the person.
I just want to look at the palm fronds.
We had one of those in our apartment in Morgantown.
Between 2 ferns, except it's between 4 palms.
Yeah.
It's kind of the same though. But no, I think this is. I mean, what do you guys
your coffee?
think? Yeah, it's my coffee.
Dude, I wish I had more.
What's up? Don't touch my truck.
1 minute.
Okay, so I think we're just going to talk about basically who we have on today, which is John Molinari, who's going to be talking about infection control and all that.
Right.
and then Debbie Seidel Bitke. I think it's pronounced that, like that. And that she is doing like several hygiene related things, including like no bloody prophies.
They're on the dental guys.
And this one.
Oh, we're having hygiene.
Yeah, that's it. That's later today.
Oh, I'm excited about that.
Yeah, yeah. So I think we just kind of
It's a
talk about
first for the dental guy. No, Laura was on years ago.
Yeah, yeah, exactly.
You know?
So they're going to give us a count.
Yeah. He,
Go ahead.
and welcome to this special live stream of the Dental Guys podcast. I'm Wes, the Dental Guy.
And I'm John, the dental guy, and we are here in Minnesota, right?
Man.
We came
And it's
up-
not winter.
No, I mean when we left, we left 80 degrees. Okay, I was, we've been up here a lot. We've been up here a lot, and you never know when you're going to see the white stuff falling. And thankfully, it was like 50 degrees, pretty nice. But let's just talk about what's going on today. We're kicking off a live dental meeting. Now, it's not the first one we've done this year. Obviously, we're out at the AO if you've kept up with us just a couple months ago. But this is the first, big general dentist meeting that we've been to since COVID. And that is super exciting. Let's talk about this meeting. Let's talk about the kind of the theme of the meeting. Why are we here? What are we up to, Wes?
So the Minnesota Dental Association reached out to us a few years back, and man, now here we are finally.
Yep.
And we're super excited that we've been brought in to help cover the Star of the North dental meeting. Now, this quite possibly is one of the largest dental meetings in the United States.
It is, yeah.
I think they're expecting 5,000 people here this weekend.
Which for this time is really, really good, because I know it's all these meetings, things have changed. We've talked about this a lot, but they're still going to have a great turnout. And, I still remember, back in 2020, I was at the Mall of America meeting with Lauren Taple, who's the scientific committee chair for this meeting. He was kind of lining us up to come and speak. So, so we're going to be speaking as well as doing interviews. And so that was literally 1 week before the world shut down. We said, we'll come cover this meeting. And then everything changed. So, of course, 2021 really was just, there wasn't much. But here we are. And we're going to be having an exciting couple of days because we have access to some pretty amazing speakers.
Well, you guys, we're all about bringing people to you that are, one, high-level people that could help maybe make a difference in your day-to-day dental practice and really cut through some of the, maybe understanding of what is it really we can bring to the practice, John? I mean, I think, we're coming off of the Academy of Osseointegration meeting a few months back, and that was fantastic, where we were specifically talking about surgery and dental implants. Here, John, we're going to talk a little bit more about what maybe you're doing in your office on a day-to-day basis.
Well, the theme of the meeting is Illuminate Better Together.
Oh.
Okay, so we've talked a lot about the value of in-person continuing education. We've talked a lot about collaboration and what that does. And I think what I'm seeing in this meeting program is a really cool theme happening of what do we do now, right? What do we do now? And we're going to be talking about what do we do from a clinical standpoint now, right? We're going to be talking about what do we do from an infection control standpoint. And we're going to be talking about what do we do in hygiene. I mean, talking about maybe workforce shortages and patient demand and the economy. But then it also all comes back to we're here together, and we're kind of starting to put back this idea of, how do we learn from each other again?
Well, are in-person meetings going to die off? Right before COVID, you and I had conversation. Especially, we are used to going to in-person meetings our entire career.
Yeah.
And we had seen a decline in being together.
Yeah.
And I think that's actually, I'm going to make a prediction. I don't think it could ever get back to maybe where it was maybe in 2007, 2008.
Right, before Zoom existed.
Yeah.
Right,
but
it's obviously changed.
I do think that we do understand now that in-person collaboration, right? Like we've said, and like instructional design people have actually said. Stephanie Tweed at University of or ETSU there in East Tennessee, she said that really it makes sense to do some of the stuff online, but to be able to collaborate and actually hash out complex issues, that's what a meeting like the Star of the North does for us.
Because what's going to happen here at this Star of the North meeting is we're going to have people coming from all over, some people that know each other, that have maybe talked through Zoom, that have maybe emailed and texted and sent photos. But now they're actually going to be together talking. After this, you know the value of this. You go to a lecture, right? And you take in the information, and then afterward, you go have coffee, or you go have a beer, or you go have lunch, and you sit with people, and you say, well, what are you doing in your practice?
And you get out the napkins.
That's right.
And you start drawing.
That's right. What are you doing in your practice? What are you doing? What's working for you? What are you guys seeing? And it creates a sense of camaraderie. It creates a sense of we're all in this together, because there's some big challenges right now. We know, I mean, can you find a dental assistant in the world, or a hygienist, for instance?
Yeah.
I mean, what are we talking about with how is the inflation and pricing changing what we do in dentistry? Today, let's talk about who we're going to have for sure on today. We know we're going to probably have other maybe surprise speakers even come in.
Right.
But starting off this morning, we're going to be joined at later, about 10:30 or so this morning, and that's Central Time, by John Molinari. And he is very interesting. He has been a CDC, an ADA, a liaison on infection control for many years, has a background in bacteriology and biomedical side of things. And we're going to be talking about what do we do now in the post-COVID era with infection control and OSHA.
Right.
That's huge.
Yeah, I can't wait to talk about this because you and I had a conversation over breakfast. We won't get into it now.
We will.
Stay tuned, but we will get into this. But, I think it's going to be good to bring somebody on that may be able to kind of shed some light on what we should be doing in our practices right now.
Yeah.
Have things changed? Will they be changed forever? Will there be new standards? Right. Will there be new types of products? Have there been new products? Is there a realization that now we need to be doing something different?
Well, and I think it all comes back to what does the science say, right, versus what's opinion.
See, and that's the thing, John, is like you and I have been critical thinkers regarding science for a long time. And there's this idea that this saying, I should say, this tagline, like follow the science. And I feel like that brings so much like disruption now that you have people that don't understand what scientific method is.
Yeah.
We have to understand that anything that we do in dentistry should be backed by science and that the scientific method. And you have to be wrong to move forward.
Being wrong is part of it. And I think that after all that we've been bombarded with, and this again is the value of these meetings of in person, like Star of the North, is that, you all have things you're doing in your practices that may be different as far as how you're dealing with, just for instance, with COVID protocols, right? Depending on what big city, small town, the politics, the mask mandates, all of that kind of thing. And so how much of what you're doing in your practice or we're doing in our practice is science-based, and how much of it's just to make us feel good, and how much of it is to show so the patient thinks we're doing something. These are the types of things that we need clarity on, because we know we've struggled on getting clarity from some of these organizations about what is important and what is just, extra.
Well, the books haven't been written yet, John.
Yeah.
Right? We know that it takes forever to do good science, right? And that's why there's a sense of like uneasiness even amongst scientists about even really endorsing anything. So I wonder if
Molinari
could bring some light to even like, can he endorse a certain thing?
Right.
Can he say, hey, this going forward? So we're going to ask some tough questions. I know that's, some of us think, well, this is something we do day to day. We use Cavicide, we use Optum One wipes, we use, Kerr products and in our offices too, and things that have, really make a big difference for our patients, that they can walk in a room and know that it's clean and safe and in an environment where, we are working in people's mouths. So we're stirring up the aerosols and all that. So stay tuned for that. I know that means a lot to all of you guys. John, recently I just hired a new hygienist, right? And, it's been a long time since we've had a hygienist on the podcast.
Yeah, we talked a ton about the implications of COVID on hygiene, right, back in 2020.
Yes.
And we had a lot of hygienists start following the show as a result because we were trying to, again, come through, figure out, was this, were hygienists in danger? We had a lot of those discussions. But now here we are with a hygienist coming in today who's kind of a big deal, Debbie Seidel-Bitke, and she's going to be talking.
Well, say that name again.
Debbie Seidel-Bitke, I think is the way I think that's the correct
pronunciation. That's a great name.
Yeah, it's pretty strong.
Yeah.
And so she's going to be talking about, one of the titles of her lectures is the 2022 Hygienist, What is Different Now?
Oh.
And that's a huge, big thought to try to condense down. So we want to try to figure out, what does that mean?
Man.
What's different about hygiene? And she also is lecturing on, no more bloody prophies is one of the other lecture titles. So
I know what that's about.
Yeah. So we may have kind of a wide-ranging discussion now on, first of all, the COVID implications, maybe coming off of what Molinari says and, what is she kind of recommending as far as infection control. But there's this other side of, like, how's the workforce changing? How are our patients changing? What's it looking like now? What are the models of hygiene that are being delivered now
John,
that are different?
A few years back, to spin this a little bit clinically, like the American Academy of Periodontology, which really writes the book on how we treat periodontal disease, right? I mean, periodontal disease, 30% of people in America have periodontal disease, right? And that is active, and it needs to be treated, right? And we talked about this new staging and grading, really, diagnosis that the dentist should be doing. Who's leading that in the general practice office? Who's leading that in the periodontal practice office? Is the hygienist behind staging and grading a disease, right? Because I know where she's going with this. No more bloody prophies,
right?
Because here's the controversial thing, right? We're not doing enough 4,000 codes, are we, John?
Right. We know that if 30% of the population has periodontal disease of some type, that we should see that reflected in the mix, the procedure mix in our practices, right? Now, we know that we'll see over time that perio maintenance hopefully is the goal,
right?
But are we diagnosing it properly?
Yeah.
Are we treating it? How much it should be left up to the hygienist?
That's right.
How much should be left up to the doctor? And I think a huge hot topic also right now is how we've got states, and this is controversial.
Yeah.
We've got states that are trying to pass laws that dental assistants can basically do hygiene because
treat periodontal disease?
Well, they're talking about doing supragingival types of work here.
So we're talking about not scaling, just polishing.
Well, no, they're talking about scaling.
Well, how do you scale supragingivally?
This is the question that I want. Let's not dive too deep. I want to see what she has to say because there are states that are right now saying, well, because we don't have enough hygienists, because there was a huge exodus of hygienists during COVID.
That's right.
Retirees, people that were nervous about being in that environment.
Or they just wanted a career change.
Just wanted a new job.
Well, you had a hygienist that decided, hey, I'm out. I want to be a real estate agent.
Want to be in real estate, right. So you got all kinds of aspects of this. And I think so now, how do you fill, because we have huge demand right now in our field for patients coming in. So who's going to do these prophies?
Yeah.
How are hygiene schools going to respond to that? So I'm interested to see how she weighs in on that. I'm interested to see what she talks about with, as you said, the staging and grading, and then I think kind of bringing it all back to where are we going from here about models, like actual clinical models of like how hygiene works, assisting works, dentist work, mid-level providers. Is that something we're still going to be seeing because of this workforce shortage?
Well, John, the dental guys, I will say this: good dentistry, and I didn't come up with this statement. A dentist told me this years ago. Good dentistry is a moral issue, and I know the dental guys stand behind that, and we're about that in our practices, and I hope you're about it in your practice, because if we're going to uphold and our patients' care in the highest regard, do no harm, right? And treat them with the utmost respect. Treat disease, right?
Yeah, it comes with ethics, right? And that's, I think, the thing that we're focusing on with a lot of this today, with who we're going to have on.
Yeah, man, I'm excited about good dentistry, right?
I know.
Yeah, because tomorrow we've got more of the same.
Yeah,
right?
And we're going to be bringing in more clinical people tomorrow, so it's going to be kind of a contrast of more clinical dentistry, and then just talking about this meeting. I mean, here we are in the exhibit hall. They put together a beautiful background and booth for us. And then we've got events coming up, right?
Shout out to the team behind this right now. We'll say more about who they are in the future.
Team's done
amazing job.
And then we've got events coming up. They're doing receptions.
Right.
They're doing a big party tomorrow night. You know, this is one of those things that, you know, we take for granted, getting together with, you know, being able to hug somebody and shake somebody's hand, and we're still kind of getting used to that.
Yeah, hugging's back, man.
But we're ready to party down.
Yeah, let's do it.
So I'm excited. I'm excited.
So if you're watching this and you're thinking, well, how can I learn more about like what's going on at the Star of the North dental meeting? Well, you can go right over to the Star of the North dental page. Just search for it on Google. It's all the information there is about the agenda, what's going on, the speakers that are here. If you're interested in questioning the dental guys, hey, right below, if you're watching this on Facebook, you can put it in the comments section. If you're watching on YouTube, we're live on YouTube and Facebook, so fantastic way for us to communicate with you is just leave us a comment. That really helps us out. And share, like, and subscribe, John.
And if you have questions for some of these guests we're bringing up, you specific questions about COVID-19 protocols, about, you know, dental hygiene, that's wide-ranging, you know, we'll see if we can work it into the conversation so that you feel like you're getting that interaction that we all want to have. So I'm excited. We're going to be back at 10:30 Central with Dr. John Molinari. And until then, Wes, we're going to be getting pumped up. We've got our coffee. I
need more coffee.
Yeah, it's time for a little bit more coffee, and then we'll be back. So for Wes, I'm John. We are the Dental Guys.